Welcome back to the Healthy Commute. I'm Dr. Dan with Dr. Pascal. So today I'm looking forward to this topic.
Yes.
We've had this maybe come up a few times this week, and we thought it would be kind of a great topic to kind of lead into. But the question basically came from a patient who was not feeling well, had acute pain, and basically saying, Doc, you probably don't know what this feels like. You've probably never had injury or pain. And we're here to tell you, no, we're just like you. We've had our fair share of injuries and things like that. But what we hope to share with you is the process that we've taken and what we are doing on a consistent basis to function and heal as best as we possibly can on a day-to-day basis.
Absolutely, yeah. I specifically think that sometimes I think it's a divine intervention that we have pain so that we can understand what people go through, right?
Yes.
So I swear it's been enough that we do totally understand exactly what's happening. And so, coming from sitting across the chair from you, it's yes, we understand, but yes, we also know that this process takes time, and that's kind of what we're going to talk about.
That's right.
What does that process look like, and not getting defeated when things don't go according to plan in your mind, right?
Yes.
What we believe and what reality is, sometimes we have to bridge the gap.
Yeah. Now, maybe to kind of take a step back. So first of all, when we're talking about injuries as a whole, right? So injuries it's not something that happens with just by bad luck.
Random, yeah.
Yes, it's not you waking up today going, oh, your body's going, I'm gonna give this to you today, right?
Yep.
No, there's injury happens when there's over kind of pressure stress onto a joint, a ligament, an area of the body because of whether it's position, overuse, underuse.
Exactly.
There's too much that the body could hold on its own. Our body was designed to function and heal and recuperate as best as possible and adapt. So whatever range of motion you're going through, exercises, stretches, sitting, it's a lot of times thinking of it the opposite way, going, wow, my body's amazing to actually be able to get through all the things I put it through, right? But sometimes it's over and above what your body was able to do for that day or that moment. And a lot of times an injury could happen.
Or a combination of the habits, and if one is building up, like you're sitting more, but you're doing the other things right, sometimes that's okay. But if you're sitting more and then all of a sudden you add another pressure or stress, that's enough to sort of overflow the bucket. Right,
and sometimes I explain it to patients almost like a balance.
Yes.
I forget what those balance, where there's,
teeter-totter.
Teeter-totter is, so on one side, there's all the great things that you do for your body. So you're stretching, you're exercising, you're getting your adjustments, you're sleeping, you're trying to decrease your stress as much as possible, the water intake, the food intake, all those good things in life. Now, on the opposite side are the pressures and stresses that come onto you. So that could be, mental pressure, stress, sitting all day, lack of exercise, lack of movement. So ideally, we want to almost balance those two out. So when there's extra pressure and stress that comes on, guess what? We've got to do an extra better job at adding those good things in life. But sometimes it tilts on one degree, meaning that there's more pressure, more stress, and less of those good things that we should do, and that's usually when we do get an injury.
Right.
And this kind of reminds me of your story that you were telling me about in terms of what you were going through with your lower back injury.
Yeah. So grad school, right? So I thought I was invincible, right? I was in a chiropractic program, probably like the best, like the image of health, what you'd think of. I was exercising multiple hours a day, eating right, getting adjusted, thinking I'm doing everything right. But over grad school, as you remember, you start, there's a lot of hours sitting, but as you get closer and closer to boards and graduation, those hours sitting go up and up and up. And then really towards the end, talking 6-7 months out of graduation, I was sitting 12 to 14 hours a day studying and putting my time in. And sure enough, I blew a disc in my back. I herniated a disc, even though I thought I was ultra fit. Just, going to do some weights in the gym, starting out my warm-up, not my heavy weights. Starting in the warm-up, something went, and, I didn't pay attention to it and didn't do enough probably right away. I just kept sitting and studying and just made it worse and worse and worse.
So
right?
I guess maybe to take a step back, what would you recognize from that, what you kind of went through there, to hopefully even prevent something like that from happening? What's the biggest takeaways?
If I could really go back and do it all over again, I think I would have split up my graduation load. In other words, probably slowed down the number of classes, because how do you get through that work without sitting for those hours? And the lesson learned there was probably slow down.
Yeah.
You know, I was trying to accelerate, get through it as fast as I could. You know, that
Yeah.
whole like push
Yeah.
the pace, push the pace, push
Yes.
the pace, and it was too much. So it was a lesson learned in like, you know, rework your schedule, and that free time, the time to take for myself was more important than trying to push through and finish on a certain time frame.
Right.
So it would be sit less. And how do you sit less? And it's not just exercise more, because
Yeah.
sure, I was exercising an hour and a half, 2 hours a day, but it was sit all day and then go crush myself in the gym and come back and sit down again. So I was still sedentary, probably 12 to 14 hours a day. So what would I have changed? Lower class load, added in a second type of exercise, much more low grade, like going for a walk, a run, maybe going to play some light tennis, and just move more throughout the day, and definitely not sit as much.
The
right?
latest research, you know, this has been out now for years, but you know, the quote saying sitting is the new smoking, right?
Yeah.
And the what they're trying to say there is you cannot undo the negative effects of sitting.
Yeah.
Just like you can't undo 2 packs of cigarettes a day and then go work out. That
Yeah.
working out is not going to undo the damage of the smoking. So
Yeah.
same thing for sitting. You can't undo the damage from sitting regardless of what you do at night or in the morning. So
Yeah.
that's a key thing to understand, is that, so okay, how can I decrease the load of sitting? Well, yeah, sit, stand, desk, don't sit for, you know, as long, do those stretches and exercises throughout the day to minimize that damage or stress. But yes, it's a tough lesson to learn.
For sure. And so, I mean, one of the great things that I learned about it was couldn't really stop at that point. I had to keep going, right? I was that close to graduation.
Yeah.
I had no choice. But what I learned was and again, if I could have implemented this before, I would have. Well, I started studying in a lunge position. So I would study, you know, with my laptop on a coffee table, and I would lunge one leg back, and then I would switch to the next, and then I would go into like a pigeon. And what I was doing is I was studying while I was constantly changing my position every 5 to 10 minutes.
Okay.
So I moved throughout the rest of those studies. I would lay on my belly, chest up in like a yoga cobra pose, and I would study on the ground, you know, and I would just find these different positions to constantly move because I couldn't sit. It was just so painful that there was no chance that I could sit. And so it taught me to move. Now, if I could give something proactive to someone, and I try to teach this to patients all the time, is, you know, if you are getting some back pain, if you are forced to sit all day or something like you're at home, change positions. You know, fine, start in one position, an hour later, switch to a different place, and always be moving. Because there is not really a bad posture if it's always changing, right?
Yeah.
Because you are moving somewhat.
Yeah.
The bad postures, even if you're, you know, perfectly erect, if you sit for 8 hours in perfect posture,
There's
still
still
not great.
pressure.
It's still
Yeah.
pressure and stress to the spine, right?
Yeah.
So motion is key, but the key is to move and move and
Now,
move there.
just to clarify this for patients as well and for everybody listening, so were you just in pain for a few days,
Oh, no.
or did this last a long time?
And I think that was the most humbling experience
Yeah.
too. Like not like understanding it, you've studied it, and all of a sudden it's happening to me, and I'm getting adjusted. I'm doing my stretches, I'm doing my traction, and it wasn't getting better. It took an eternity. It actually took 18 months, I think, before I truly noticed that the pain was gone.
Right.
18 months. I mean, for the first few months, I couldn't put my socks on. It was to that level, right? So almost thinking like, do I have to find a new career, right? So it starts to play on your mind,
Yes.
like, you know, even though I know this stuff is going to get better over time,
Yeah.
and that's where I really feel for patients is it starts to play on your mind after 3 months, after 6 months.
Is this
almost
ever,
like,
is this ever,
ever
going to
go away?
Is this ever
Doc,
going to
is
get
it ever
better?
going to change?
Yeah.
And, you know, I keep telling people, yes, it will, and I've been there. I know
Yeah.
that it literally takes an eternity. I mean, it takes a long time of constantly doing the right things. Now, had I given up and not done those right things,
Yeah.
could I still be in that amount of pain today? I think so. Or would I have needed surgery
Yes.
to get the disc herniation removed? Very likely. But, you know, I continued through following my care plan, doing everything right. You know, my stretching, mobility, nutrition, exercise, adjustments, traction, massage. And then, you know, about 2 years later, I was actually stronger, hitting, you know, in the gym, deadlifting weights, you know, things that would be quote unquote scary.
Yeah.
You know, I was heavier, as getting 50 pounds more on my deadlift, PR'd my snatch and my clean and jerk because I did those right things and actually learned how to train even a little bit smarter and got stronger because of which.
Yeah. So I think that's where we have an advantage, right? Where we could trust the process because we know the process inside and out, but also we also have the knowledge and understanding of, because we've seen it thousands of times with our patients,
Yeah.
where, you know, where something seemed, you know, incurable, or somebody was, you know, this is never going to get better, and then if there's a dramatic change in their life. So we've seen that change. So when it's happening, we could then say, no, trust the process. But we also understand from the patient's perspective that they don't have that, you know, same understanding or training or just knowledge or trust that yes, the body is designed to heal. That's its normal state.
Yes.
Our job is just to allow that to flourish as best as possible by removing as much of the blocks or interference to allow your body to recover and heal the way it was intended to in the first place.
Absolutely.
Right? The best way I could describe it also always is, you've got a bad internet connection at the house. My job is not to put like the power of that, kind of Wi-Fi connection. My job is just to take the signals, so that they're not crossed, and allow as great of a connection so that you could do whatever you want to do, your Wi-Fi, your games, all that kind of stuff. So that's our job, is removing that stress.
Absolutely.
Now, yes, there's stretches, there's exercise, there's, there's nutrition, there's physio, there's all these other things that could add on and help your recovery process. But again, it's just allowing that body to recover the way it was intended to.
Absolutely. And then there's 3 buckets, if you will, right? The way that we look at it and we explain to people. To get the best results, there's 3 things that you need to do on a consistent basis to help this heal. 1 is get adjustments.
Yep.
2 is to do the positive stretches, exercises, and traction at home. 3 is to decrease your bad habits, right? And if we start...
So just maybe to stop there. So
yeah.
like you were saying in your story, like you were doing, your adjustments, your stretches, you were doing everything right. But that third bucket of those bad habits is, so same thing, you could do everything right in some other areas, but if we leave one of those kind of out, then that'll still trigger an injury or something like that.
Right.
So sometimes it's hard to understand, but yes, unfortunately, we have to do as many of those things right.
And unfortunately, sometimes it takes a wake-up call like that to make you realize it is a bad habit, right? Because sometimes, in ourselves, we have blinders on thinking, well, I'm not doing that much, or maybe I didn't think I was sitting that much. Or change the bad habit by changing, the stretching position and so on and so forth. But the hard part, I think, is when people are in pain at first, they say, Doc, it's been 4 adjustments. How come I'm still in pain? Doc, how come I'm still in pain? And there's it's really hard to explain to people how the brain works and the pain game and so on and so forth. And it's really important that people also realize that, I'm not adjusting this bone because the pain is there, and as I move that bone, the pain goes away. Yeah. It doesn't work like that at all. We're readdressing the spine so there's less stress and strain to the nervous system, so there's less stress to the spine itself. Mm-hmm. But really also by adjusting you, we're changing the way the brain perceives pain. And that's really the biggest role chiropractic has in bringing your pain down, is affecting how your brain perceives pain, right? And it's hard to explain that, and that's new for even us as professionals. We're learning more and more about the brain and pain science, but chiropractic adjustments change the way your what's called frontal cortex, prefrontal cortex, perceives messages in the body regarding pain and perceives the environment of pain, right? So sometimes it's like, well, Doc, you're adjusting me up here on my neck, but Doc, it hurts right here. Like you get that one all the time, right? Why are you adjusting me here when it hurts here? Well, because this is actually where the pressure in the spine is, and that's going to affect your brain's perception of pain a lot more. Yeah. So that's number 1. Yeah. Right? His number 1 bucket is get adjusted consistently, and don't necessarily worry about where the pain is and how come it didn't get better on last adjustment. Right. Right. Yeah. Number 2 is exercises. Right. Well, your shoulder is a perfect example of doing the right exercises, right? Yes. That shoulder pain that we were trying to figure out what's going on, and now you're figured out the right exercises, and the difference is huge, right?
So for me, my I guess struggle, if you want to call it, over these last few months is I've had some shoulder injuries in the past. And then plus what I do for a living, right? I've now been a chiropractor for coming up to 21 years. So how I, adjust and the kind of the pressure stress that happens on my body. Now I try to do as best as I can in terms of my daily stretches, exercises. I get adjusted every week. I do all of those things right. But again, in terms of the capacity, there was just, over and above what my body was able to handle without me changing something. So one of the key things that I've changed is the stretches and exercises that I do for my shoulder, and that has dramatically changed, how I'm functioning, feeling, and improving. So again, it's a process, right? Yeah. Nothing happens overnight, but it's a process, and I know that if I trust that process, I know that I will be able to, in 20 years from now, still be able to adjust and go tobogganing or whatever I want to do if I can, put that work in.
Absolutely, and that's the thing too to realize, is that you haven't changed the rest of the things. Like you haven't changed the fact that you have to do this, for your profession, for your livelihood. You're constantly thrusting through, and I don't know if someone's never done it, they don't realize the pressure on your shoulder, but it's pretty darn intense to be able to adjust someone's low back on a shoulder joint. So to be able to keep doing that with doing those exercises is a big win, but it's just a small modification in the exercises that you're doing, right?
Totally. Totally. So I don't know if there's anything else that we could add to for patients, but I guess hopefully what you could take from all of this is there's a process involved, right? And if anything, if you have to just, trust us to trust the process at the start, that's okay. That's our job,
Yeah.
right? We want to just help you along, kind of teach you, guide you, but there is a process in place, and for exactly that reason, to basically reteach your body that everything's going to be okay, movement is good, and reintroducing good positive movements so that things could continue to improve. And we also talked about, like you mentioned, those 3 things that are needed for healing, right? Those adjustments, those proper exercises and stretches, and removing or stopping as many of those bad habits that add pressure and stress to our bodies.
Absolutely. Remember, you get your best results over time.
That's right.
It is very simple. The longer you do the right things, it's like anything else in life. It's that slow, consistent,
Yes.
small little efforts give you big results, but long term.
Exactly right. So hopefully that could help you and maybe understand a little bit when you say, Doc, you probably don't know what this feels like. Yeah, actually, we know exactly what that feels like. It's just we're coming at from maybe another perspective and for a while. So hopefully that could help you and maybe understand a little bit more about how things work in your body. So again, if you have any other questions or concerns, you can give us a call here at the office, 204-474-1159. And hopefully you have a great rest of your healthy commute.